Hello, my name is Georgette Alianne and I'm a diabetes specialist dietitian for the West Hampshire Community Diabetes Service. In this short film, I'm going to talk about the glycaemic index. The glycaemic index, or GI, explains how different carbohydrate foods are broken down and digested by the body at different speeds. Foods containing carbohydrates can have a high, medium or low GI. High GI foods will be broken down and absorbed into your blood quickly, causing your blood glucose level to rise quickly. Low GI foods will be broken down and absorbed more slowly, causing the blood glucose level to rise more slowly. Here is a table showing some examples of which carbohydrate foods are considered low, medium or high GI. For example, white bread would be digested quickly, causing your blood glucose levels to rise more rapidly than, for example, if you were having some granary bread, which has a lower GI. If you want more details, please refer to the website www.glycemicindex.com. The GI value of a carbohydrate food is calculated when it's eaten on its own. However, in reality, we generally eat foods in combination. For example, a jacket potato itself is a higher GI food, but when eaten with something such as baked beans or tuna or cheese, this would lower the glycemic effect of the meal. It's also important to factor in the portion size because this will have the biggest effect. So if you were eating a larger amount of a medium GI food, this would have a greater impact on your blood glucose levels than, for example, a small amount of a high GI food. Cooking methods also affect the GI. For example, pasta that is overcooked has a higher GI when eaten than when you're having something that's al dente or firm to the bite. Higher fibre foods such as lentils or pulses are more slowly absorbed by the body. High fat meals such as pizza or fish and chips are also more slowly absorbed, as the fat content can slow down the digestion by up to 6 hours. What this means for your bolus insulins is that they can be acting too quickly, and there are a couple of things which might happen. One is that your blood glucose levels may drop low initially because the carbohydrate hasn't been broken down yet, possibly causing you to have a hypo. Or your quick-acting insulin, which lasts for up to 5 hours, might have already left the body before the carbohydrate foods are fully absorbed, causing your blood glucose levels to rise some hours after eating. There are different strategies that can be used to manage these types of meals. For some, they may be happy to give a split dose of your quick-acting insulin to cover the different absorption rates of the food you're eating. Over time, as you're monitoring, you will learn how your body absorbs these foods differently. Your dietitian can also provide you with more information about the glycaemic index and look at your individual response to different foods and help you match the timing and doses of your quick-acting insulin better.
Thank you for watching. This video is part of our Type 1 Structured Education course. For individual advice, please speak to your healthcare team.